To access the Musculoskeletal and First Contact Practitioner template within System 1, simply press F12 on your keyboard. This will activate the F12 launcher, where you can search for and save your favourite templates for future use. Once you open the MSK template, you have 5 available tabs. These are the History, Examination, Management, View, and Resources tabs. In the History tab then, and the Appointment section, you must first record the Seen by First Contact Physiotherapist code, as this is a requirement of the PCN-DES. You will see the blue star in the bottom right of the template, and this allows you to access the PCN-DES template itself. Further, you can also record details about the encounter, wait time, and source of the referral. And if you want to add any additional information, just use the pencil icon to the right-hand side. In the History section, the History free text box is useful for you to record the presenting complaint and any relevant subjective information. You can record the body part that you are assessing and access the body drawings template via this quick action button. Here you can annotate a body drawing or select alternative body images from the drop-down box. You can also enlarge images if they're too small via the magnifying glass here. There are more drop-down boxes to input further information about the patient's symptoms and pain levels. And you will see that there are quick action button links to commonly used screening tools and outcome measures in the scores section. Take, for example, the Start Back template, which you can access here. You can also access the Vitals and Lifestyles template and input any vitals taken or body weight measurements, for example. On the right-hand side, you'll see any previous historical values for you to compare with. Also, you can input lifestyle information like alcohol intake, diet, exercise, and smoking history as well. There are further specific templates for the management of other common MSK complaints and pathologies. And in the background section at the bottom, you can tick to document that you have adequately reconciled the patient's medical history. You can use this View link here, which will open the View tab, showing you a condensed summary of the patient's history, including any active major problems, allergies, current medications, and more. In the following boxes, you can add free text information about additional medications, medical history, etc. Next is the Examination tab, and here you can record if a chaperone was present, and if there was, it's always best to use the pencil icon to record details such as the chaperone's name and/or contact details as well. Below this, there is an examination free text box, which allows you to input all relevant clinical and objective findings. And then you'll note the flag sections at the bottom of the tab. Here, the red flags are now split up into general, inflammatory, back and neck pain. Each is a free text box, but you can also click the document icon to the right-hand side and add any preset information. And the yellow flag box at the bottom can be used in exactly the same way. In the Management tab, you can record your clinical impression, and there are 2 drop-down boxes available for when there is multiple presenting complaints. You can search the read code browser and add a specific read code, or alternatively, you can add a free text impression if you aren't completely sure what's going on at this stage. You can record the appropriateness of the triage decision or the referral, and below this there is a treatment plan free text box to document the ongoing management plan for the patient. Here, there are multiple tick boxes to document your advice on diagnosis, expectations and self-care, as well as advice on treatment and safety netting as well. Below this, there are then multiple fields for recording further advice, investigations, interventions and onward referrals, and on the right-hand side of these fields, the quick action buttons will allow you to seamlessly transfer into other Ardens templates and resources. Here, you can record any medication advice given, and independent prescribers may choose to access the adult analgesia formulary and directly prescribe medications. You can record the intention to refer for blood tests, and via this quick action button you can access the phlebotomy template to make a pathology request. Importantly, you can also use this template to view any previous blood results that have come back. You can give your patient a care plan and choose from a wide range of Ardens resources. And here is an example of the Corda Equina care plan, which you can print and email to your patient. If you are supporting patients with remaining in work, you can document any fitness for work interventions and directly access the AHP Fitness for Work report. Imaging referrals can be made via the radiology template. You can document the administration of a joint injection or the intention to refer to an injection clinic if this speciality is unavailable within your setting. If you are administering joint injections during your practice, the injections and aspirations template is useful to ensure best practice and full, concise documentation. You can record any onward referrals and access the physiotherapy referrals template and access the MSK referral criteria as well. At the bottom of the tab, you can record any follow-up consultations and book this via the follow-up quick action button. Lastly, in the Resources tab, there are URL links to a plethora of resources which can be useful to give to your patients. You can copy and paste these links into an SMS or email via this action button. There are further links at the bottom of this tab to CKS and NICE guidelines, as well as wider professional bodies and even medico-legal advice should this be necessary. Lastly, you will note in the top right-hand corner of all of these template tabs is the Help and Feedback link. This will take you to the First Contact Practitioner Support Desk article. You will also find links to our support desk for wider information on other Ardens resources. And there is a link to contact our support team directly via email if required.